One in five suffer.
Erase the stigma.
Brain difference is not a crime.
Mental health isn't just your problem.
It's our problem.
And now, Mental Health Mondays with Marla and Dave.
Welcome to Mental Health Mondays with Marla and Dave.
Mondays, plural, because every week there's a Monday. So that makes it a continual Mondays.
Yes. Well, if you're a fan of the show like we know you are, you remember our last episode with Dr. Allycin Hicks, otherwise known as Dr. Ally. She shared some great information with us, told us about her journey, and we're going to remind you that she is a mental health relationship expert, a television personality, a founder of the DOUX or the DOUX Consulting Group. She holds a PhD in clinical psychology and uses her 10 plus years of knowledge in human behavior to help reconnect people with their true purpose, happiness, and creativity. She does
also
all of that.
She lectures at Cal State LA. She's been featured on networks including OWN, VH1, MTV, NBC, all the alphabets. Frequently writes and is featured in articles for outlets including Black Love and Not and Bon Appetit, and is featured on a number of podcasts, including ours.
Absolutely. And when we come back, we will continue our conversation with Dr. Ally.
Don't move.
Help someone who is struggling by supporting the National Alliance on Mental Illness and be a part of the NAMI effect. Hope starts with you.
Hey guys, listen up. Learn something.
As promised, we're back with Dr. Ally, and welcome back to Mental Health Mondays. we love.
She greets her crowd.
We love having you for sure. You know, on this show, we usually open up and we like to always remind everyone. Part of the reason we bring this is to be sure that everyone in our hearing of our voice understands that when it comes to mental health and mental health challenges, that you absolutely are not alone. And we also say, even in our intro, you know, 1 in 5 people is affected, and it's really 1 in 4. And now I believe it's like almost everybody in some way, based on the stresses that we've been dealing with where we are just as a people, and COVID, and being in I call it COVID captivity.
Yeah.
And one of the things that I really wanted to get into today was to get some real steps of help from our esteemed doctor, Dr. Ally, as far as, you know, what it is that people are dealing with. And I think that now people are probably facing mental health challenges and differences that never even thought that they would be included in that process.
Yeah. Well, Dr. Ally, like Marla was saying, during this pandemic, everyone has actually had to endure an extra notch or two level of stress. And the prolonged exposure to this level of stress can be very traumatic for some, debilitating for others.
It's situational PTSD.
Always negatively affects just about everyone. What are some of the ways that you suggest that we kind of deal with this at the various levels?
Absolutely. This is absolutely unprecedented. The levels of trauma that we are experiencing, both big T, little t, primary trauma, which means trauma that happened to you, secondary trauma, which means it happened to somebody you loved, or tertiary trauma. Just watching it on the news is traumatizing. Okay? Watching all of the things that have been happening is traumatizing for so many of us. So a group of not just psychologists, but psychiatrists, mental health professionals got together. Well, they didn't get together, but somebody did a study and asked all of these mental health professionals, hundreds of them, what are some things that you think will get us through this period of COVID and the unrest and everything? And they had 4 things. And one I mentioned at the end of your last episode, which is having an optimistic outlook. That doesn't mean that we deny the reality of what's happening. I'm not into toxic positivity. I'm someone who fully believes in letting people mourn and mourn completely. If that means you have to fall on the ground and cry, do it, right? But also having a perspective that, like I said before, things will change. It's inevitable. We got through civil wars, we got through slavery, we got through the pandemic of 1918. We got through the Great Depression. We got through the Dust Bowl. We got through the 60s. We got through Reconstruction. We got through all of these things.
This too shall pass is applicable.
This too shall pass. We will get through it. It is absolute, but it does not change how horrible it is. I lost my father in 2020. I've literally lost 4 people in the past 18 days.
And a couple we know in common.
Yes, we have some of them in common. And it's absolutely mind-blowing. And so I'm not saying something that I'm not actively practicing in my own life. So optimistic outlook is one of the 4. And then the next one was creating long-term goals. So when you really focus yourself on the future, beyond what's happening now, and start to figure out, what is it that I want? And when I talk about creating goals, I tend to go toward like the SMART goal perspective: specific, measurable, attainable, reasonable, and time limited. And y'all can look it up, SMART goals, SMART. And creating these SMART goals for the future. So it gives you something to look forward to. It kind of taps into that optimistic perspective. And then we have holding on to your social connection. We cannot engage with people the way that we used to, but relationships are at the center of human life. And so we have to make adjustments. We're not all able to hang out with, elderly family members or maybe really young family members or travel to see people in the same way. But the best that we have sometimes is video. The best that we have is going by someone's house and waving from your car window if you need to. I literally had a conversation as I was walking down the street with a paramedic who was doing something. And just being that close to another human person and speaking to them was for some reason so life-giving.
Wait a minute. You're in the car and they're walking?
I was walking.
Oh, and they were in the car. And so, okay, so they're pacing and you're just...
No, the firefighters were coming into my building.
Oh, okay.
And I was just telling them where to go.
Got it.
But the conversation that we had, I hadn't had a conversation with a person that wasn't in my house.
Right.
in like 8 months.
Right.
And I became so aware of it. And it was just nice to connect, right? Because
refreshing.
It's connection. And then the final one is having a purpose. Having a reason to wake up. Having a reason why you're doing the things that you're doing. And so I have a platform right now called the DOUX Collective. And as a part of the DOUX Collective right now, we are focusing on finding purpose. And how do we go about systematically tapping in to figuring out why we are here, why we exist. And that's something that can get you through times like these.
Yeah, well, a lot of times focusing on existential issues like that can be helpful. But, this whole, I guess they call it the malaise that we feel, it's not really something a stress that's like level 10. It's just a constant background noise of level 2. And especially with the political scene that we've been dealing with lately. Is there a mental health professional approach? And this is going to be a strange question, but to something like, say my neighbor might be stand for one political party and truly believe that they're correct, and I fully disagree. Is there some way? It seems like those wedges are being made, just driven deeper because of, is it in addition to this COVID stress that we're dealing with, or it just seems like people don't have the patience to deal with each other anymore?
Might I suggest you shut your door and when you walk outside, Bob, Dave, and then get in your car and leave?
If it were that easy.
I don't have a degree in psychology, so maybe that was why my answer was so simple. What do you say to that, Allysin?
I think that's a great perspective. Sometimes you don't always have to have the deep conversations, right? I'm a person that despises small talk. So I find myself in these heavy conversations and having disagreements with people. But what I've learned is if you focus on the things you have in common, conversations tend to go better. It's like the number one technique that you use when you're attempting to de-escalate a really angry person. The first thing you say is, you know what, I get it. If I was in your position,
acknowledge their feelings.
Exactly. Acknowledge their feelings and acknowledge that they're real and they have a right to have them, right? It's okay if you feel scared right now, because guess what? Absolutely terrifying outside.
Yeah.
Absolutely terrifying. There's nothing wrong with being scared. And I think that the pandemic isn't making any of the divides that we already have that existed in this country better. It's not making any of it better, because now we have people that are afraid. And on a neurological level, when you're afraid, you tap into your amygdala. And when you make decisions with your amygdala, you're not really using your whole brain. as opposed to when you make decisions with your frontal lobe. So when you make frontal lobe decisions, you tend to really integrate more information about like, okay, this is Bob. He's a guy that has 2 kids. I have a few kids. We have some stuff in common. He likes to drink kombucha. I like to drink kombucha. Maybe he's not that horrible of a guy. But when fear and your amygdala is really in control, it's like, that guy's different than me. He's from a different group. That group doesn't necessarily be race. It can be a political party. It can be ideology. It can be religion. You start wanting your own group when you're afraid.
All right, hold that thought, Dr. Allie. We're going to come back with more of this conversation. She's giving us great coping skills. We'll be back after this break.
When Dave and Marla get together, it's hot.
Psycho, nutcase, schizo. You may not realize it, but these terms, often used to describe someone with a mental health condition, can be very harmful. In a country where 1 in 5 people are affected by a mental illness, it's time for all of us to step up and change the conversation. When the discussion on mental illness focuses on fear instead of hope, people struggling with these conditions get caught up in the judgment and shame attached to them. They become lost in all the talk and harmful words, and they may not get the support they need. But we can help by directing our loved ones to places like NAMI, the National Alliance on Mental Illness, for life-saving resources. Just because someone's struggle isn't obvious on the outside doesn't mean they aren't hurting on the inside. We need to see the person, not the condition. Join me. Pledge to be stigma-free.
When Dave and Marla get together, it's hot.
It's time for the Mental Health Minute with Marla and Dave.
Marla, Dave.
Bulimia is an illness in which a person binges on food or has regular episodes of overeating and feels a loss of control. The person then uses different methods, such as vomiting or abusing laxatives, to prevent weight gain.
The disorder is most common in adolescent girls and young women. The exact cause of bulimia is unknown. Genetic, psychological trauma, families, society, or cultural factors may play a role. Bulimia is likely due to more than one of those factors.
In bulimia, eating binges may occur as often as several times a day for many months. Binges lead to self-disgust, which causes purging to prevent weight gain. Purging may include forcing yourself to vomit, excessive exercise, using laxatives, enemas, or diuretics.
If you or anyone you know shows any signs of bulimia, please seek professional help immediately. And this message is brought to you by Mental Health Mondays with Marla and Dave.
David is a thinker.
I never do anything without thinking about it first.
Marla is a feeler.
I basically wear my personality on my sleeve.
But when Marla and Dave get together, it's like a match dancing with a firecracker. Marla, Dave.
All right, we're back with Dr. Allie, and she was right, walking us down the road of some very valuable tips in the current environment that we're living in, and managing our COVID confinement, mental imbalances, really.
Yeah,
anxieties
that we deal
I have
with.
a question for you, Dave. Your personality, we've known each other since we were kids, has always, to me, lent itself to what I would consider more of you're like a power saver person. Like, you're always on a neutral wavelength. So are you feeling, is there anything specific that you feel directly to be different in you surrounding the COVID confinement?
Just the general malaise that I was speaking about, but I naturally do one of those coping mechanisms, use one of those coping mechanisms that Dr. Allie was talking about, is an optimistic outlook. No matter how dire something is, to me, it turns the negativity that I'm feeling into a learning experience so that I can try to avoid it in the future. And I just keep working on ways to do better and seek peace. That's my main goal.
Peace-seeking Dave.
That's me. Now let's turn the conversation to diagnosis and labels. One of the things that we were talking about in the last episode, as you were telling us about your work with young girls, young women, really is helping them to meeting them where they are and not really allowing a wall of defense to actually come up, but also helping them to see a bigger perspective and in that way maybe seek some change. How important do you think a diagnosis and a label is? Because that to me is somewhere in there, it is where the stigma starts to really set in.
Yeah, I think when it comes to diagnosis is meant for your treatment team, right? It helps your treatment team understand what it is they're going to do. Like if you had heart disease with, and had, a specific type of heart disease, it would help any doctor that was seeing your charts have an understanding of like, we should start with this treatment. And so when you come in with a major depressive disorder, recurrent, most recent episode, moderate, your psychologist, psychiatrist, therapist, clinician, whoever knows, okay, this is where we can start. For example, cognitive behavioral therapy is kind of the treatment that is recommended specifically for major depressive disorder. And so it gives them an idea. But I think what's happened is we've begun to internalize a lot of these diagnoses. And it's not a new thing. Actually, what I think has happened is over the course of time, we have demonized people, literally said they were full of demons and witches and all kinds of things because of mental health issues. And so we made a person their illness as opposed to understanding the fact that an illness is something that you deal with for a period of time.
You manage it.
Cope with, something that you manage. For some people, it is transitory. It comes and it goes. For other people, it might stick around a little bit longer. But it is not something that we are. It is not something that we identify as, but it is something that we have. And a lot of times I'll tell my clients, well, are you the flu? Like, no, of course I'm not the flu. And it's like, okay, you had the flu. So don't say I am a manic depressive. I am borderline. No, you are not. You have those things. You may deal with those things from time to time. And really what you're dealing with are symptoms that come together to form these diagnoses, which are shortcuts that professionals use to really begin to understand how to treat somebody. And so I think if we start to separate more so the fact that this is a term that we're using to understand what the treatment should be, as opposed to describing a person, right? It's not an adjective of who somebody is if they're a person who's dealing with depression or anxiety or obsessive compulsive disorder. It is something that they're dealing with. Yeah.
So you know what? I'm just out of my own curiosity, and we've all been there, and for us being affected so close to the vest with children who have mental health challenges or differences, it really brought an awakening and an awareness within me as to my own language. So it's one of the things that I vowed to stop doing and saying, which I think I've done pretty successfully, is to say, they're crazy. And I've done it a couple times and corrected myself. What labels would you, Dr. Ally, that you hear on a regular basis in this field, which ones would you want to just dissolve?
Well, see, that's kind of hard too, because I think that mental health has done a really good job recently. And some people don't agree, but the DSM-5 came out and it changed a lot of terms, because some terms, like back in the day, they used to use the term mental retardation, which became a very negative term,
right?
Which became, cognitive deficits or, mild cognitive deficit, severe cognitive deficit. And so they've tried to do their due diligence. But really what I'm interested in is I want to add a few more words to the whole situation.
All right. So you don't want to dissolve, but you're about additions. So what additives would you like to put there?
I really want to add a specifier for people who are dealing with racism and prejudice. And because there's some of us, brown folk, that on occasion have to deal with every single minute of our lives, have to deal with racism and prejudice, and depression in somebody that is African American, that has been ensconced in a society that does not love, accept, or acknowledge who this person is and the pain that they experience is going to have a different depression. It's going to look different.
That's a very interesting outlook.
Who doesn't have to deal.
That's a very interesting point, and we're going to get a little bit more into that right after this break. Everybody, this is riveting. Don't go anywhere. More with the Dr. Ally after this break.
All right, it's poll time as the music indicates. Marla, what was last week's poll question?
Last week, we asked the question, what percentage of all global diseases are either mental, neurological, or substance abuse disorders? And I believe Dr. Ally gave us her answer, and now it's time to find out if she's going to
The
remain the
big
champion
reveal.
genius.
Your options were A, 3%, B, 7%, or C, 10%.
Dr. Ally said.
And Dr. Ally once again guessed it. It's 10%.
She reigns supreme.
She probably didn't guess. She is Dr. Ally.
She's Dr.
after
Ally.
all.
She reigns supreme. She does. I just want her to know that at our next social event, if we end up in the same place, you are going to be on my Jesters team. Dave, what's the next poll question for this week?
What percentage of mental disorders begin before the age of 14?
Huh.
And your options are A, 33%, B, 50%, or C, 68%.
And this is our chance to check in and see if you're going to be 3 for 3. What percentage of mental disorders begin before the age of 18?
33%.
Began.
50 before the age of 14.
I'm sorry, 14.
33%, 50%, or 68%.
I'm between A and B. I'm going to say A, 35%.
Well, we're not going to know.
Find out.
We'll let you know next week if you've been the undefeated champion of the poll question.
Guys, we're having fun. We want to remind you that the Mental Health Mondays GoFundMe page is available for you to help support what it is we do here. If you love it, help and support it. We will be right back.
All right, we're back with Dr. Ally on Mental Health Mondays. What a great conversation. So you were literally, I was asking you about what labels you would like to dissolve, and you jumped out the box like a jack in a box and said more than dissolving. I actually would, there's a couple things I see that could be useful to be added to the DSM, which is the diagnostic, what's the full acronym? DSM, the diagnostic
Standards.
Manual.
What's the middle one? Statistical manual. And so continue to expound.
Yeah, I would add specifically related to systemic racism as a specifier. So when I say specifier, like we talked about major depressive disorder, you can have specifiers on the end. So you can have major depressive disorder mild, major depressive disorder moderate, major depressive disorder as related to, substance abuse, something like that. And so another specifier that I would like to add would be related to systemic racism. And it wouldn't just be for depression. It would be hopefully for a number of different things, because I think that there's no question anymore. The research has shown us that living in an environment of systemic racism where you are subjugated to feeling less than in almost every area of your life, it is difficult to not have mental health sequelae as a result of that. And we're seeing example of that for, right now when it comes to medical mistrust. There's nothing about my Black skin that makes me mistrust doctors. The reason I mistrust doctors is because in this country, they have abused us. End of story. And we cannot ignore that. And at the same time, it does hurt us in the long run, because as Black folk, if we're not going to the doctors regularly, we can end up getting sicker. But we don't trust the doctors because it's a scheme.
Right.
So we're kind of stuck in this catch-22. And so I think it's important to not just demonize Black and brown and people who may have any issues associated with racism, but understanding in context. Again, so when they're being worked with by, like a new treatment team or a new doctor or a new therapist, it's easy to understand that this person has dealt with racism. That is what I'm dealing with right now. You know
what's interesting? As she brings this up, we've learned so much in our personal journey. And one of the things that we've learned is that the real culprit of certain mental maladies is driven by stress and trauma at the base. And the truth be told, as she's talking about this, we'd have to be honest that as a people, as a collective group, African Americans started in this world traumatized. Our traumas are from the beginning of being here,
our time here,
and so we don't even. I don't think I've ever looked at it like that, but I think that that's probably a really good idea. It helps to explain that it's not just, like you said, you have to acknowledge that it didn't just come out of nowhere. There have been real events that have traumatized African Americans.
Well, one could dream of a racism vaccine that could just do away with it. But Dr. Ally, I want to go back to something that you keep referring to, and it's something that seems important to me. You said your mental health team. Explain to me why it's important. First of all, what components should you have in your team, one, and two, why it's important to have a team?
That's it. And I think every celebrity knows how important it is to have a team, right?
Right.
You have to have a bunch of people that are doing a lot of things for you, because we cannot do it all on our own, especially if it's something major like a mental health issue, right? It's not, you can't bear it on your own all the time. And I really recommend that no matter what your position is, find a way to build some type of team. So when I speak of team, for some people, that team may include a psychiatrist. Not everyone's going to need medication, but some people will. And so having that person and having their contact information, knowing who they are, being able to reach out to them and get an appointment. And then some people may have social workers as a part of their team. Maybe they're coming into your home. Maybe they're helping you gain access to services. Maybe you have a therapist or two therapists that are on your team. And listen, if you're in LA, I got a dream strategist, y'all.
So when you're putting your team together, right quick, what is the best practical advice that you can give us when you begin to consider searching for help?
Yeah, so you got to figure out what you need first, right? You have to know, where am I? What are my challenges? What has been changing in my life? What was doing one thing that I really enjoyed and now it's not going as well? So you can start to really assess, like, what do I need? Okay. And then the next thing I think about when it comes to like building a team or anything like this is, what are my finances? Like, can I, the average therapist is anywhere from, some people are charging maybe around $30 in certain areas, but the average therapist is charging around like $75 to $100. So if I'm supposed to see somebody every week, how do I afford this? If you just got the money, kudos to you. And, find a clinician. You can find clinicians in a number of different spaces, from therapy for Black girls to Psychology Today. There's so many resources where you can find access to really great therapists. But if you're like kind of concerned about the finances, consider going through your health insurance. Go to your health insurance website. They will show you a list of therapists in your area, psychologists, psychiatrists in your area. Also, these other sites that I mentioned earlier have features where you can, say like, okay, Blue Cross Blue Shield, whatever your insurance might be. And that's one way to begin to kind of like figure out, like, who can I have on my team? And normally if you get one good central person, I tend to say kind of like start with a therapist, whether they be master's level, PhD, PsyD, whatever, because they can start to connect you with the rest of your team. They can get you referrals to psychiatrists, they can get you social workers, and they can gain you access to other types of services that you may need.
Absolutely. So, and for some people, depending on what religion that you are part of, your religious
there's always
leader
community groups
could also be part of that team. So it's just something that like Marla said, continually connects you to your community, so that you can feel that connection, so that you will feel less alone. I would guess. This is a great conversation that we're having with Dr. Ally. As usual, she's the best, and we'll return with more.
Bad.
What are you doing?
Looking worthless.
Don't trust them. They'll hurt you. You're worthless.
It's pointless.
When the pain of schizophrenia meets hope, everything can change. Help someone who is struggling by supporting the National Alliance on Mental Illness and be a part of the NAMI effect. Hope starts with you.
It's raw, real, and unfiltered.
Well, Dr. Ally, we've come to the end of our time. Man, you have been a wealth of information.
Amazing. Her transparency.
Love it.
It's been informative, educational, as well as compelling. So we appreciate you. We're honored that you would be our guest, not just for one show, but for two. Thank you so much.
And when it comes to mental wellness, thank you for the step-by-step process, but leave us with one thing always, just one good nugget on our plate that will give us hope.
Just love on yourself for the rest of the month. This is a hard time. I've been having a lot of people write down all of the amazing things they did last year. Any success, any award, any act of kindness that you engaged in, and hold on to that list. Keep it close. Remind yourself that you are worthy of the love of others and the love of yourself.
Thank you so much, Dr. Ally. For all you guys out there, be safe.
And we're going to call on you again for some things that we have coming up. I know that we're talking about our mental health telethon, possibly, and some other events that Mental Health Mondays will be sponsoring. We'd love to have you continue to be a part of Mental Health Mondays.
Thank you so much, you guys. Remember to stop by the Mental Health Mondays GoFundMe page. Have a great week. Like I said, stay safe, stay healthy, be blessed.
And we'll see you next week on Mental Health Mondays. Bye.